No, there will not be a mandate for kids to wear masks at schools. We know from the evidence around the world that's not needed, but there are other ways, important ways of being able to learn in classroom for young children, for children of all ages, that can be done safely. And masks for long periods of time are not recommended by anybody in any situation. We know that is not what keeps people safe. If we talk about our hierarchy of controls, the most important thing is distancing, making sure that we have small numbers of people, making sure that we have barriers in place, administrative ways of reducing risks. And for schools, we've been doing a lot of work with the experience that we've had in June to understand how that can be done safely across all grades. And we'll be talking more about that coming up. There's been a lot of thought and effort put into it by groups, including the teachers' unions, learners and parents, as well as our school districts around the province, and my office has been involved as well. So there'll be much more information coming about that. And our goal is to have as many children as possible back in school in a learning environment. We know that it's important for a whole variety of reasons for children to have in-classroom learning. And we know that it's important for educators to have that environment as well. And it can be done safely. None of us wanted to have a pandemic imposed upon us, for sure. But we do know that we can manage this safely in our schools, and we'll be looking at how we can do that. And more information will be coming soon. So today I'm announcing we are reintroducing a mask requirement across British Columbia for all indoor public spaces. This measure is needed to ensure that these indoor settings are as safe as they can be for all of us as we head into the fall and we spend more time in activities, whether it's school or other activities indoors. So a provincial health officer order will require masks to be worn by all British Columbians 12 years of age and older in many indoor public settings starting tomorrow. So this will include malls, shopping centers, coffee shops, retail and grocery stores, liquor and drug stores, city halls, libraries, community and recreation centers, restaurants, pubs and bars, unless you are seated once you're at your table, on public transit, in taxi or ride-sharing vehicles, in areas of office buildings where services to the public are provided. So this is to address those situations where we are in an indoor setting with people who may not yet have been vaccinated. We also will cover common areas of sports and fitness centers as well. And, as mentioned, common areas of post-secondary institutions and nonprofit organizations, and in schools for all K-12 visitors, students, and staff in grades 4 to 12.
One of the key pieces of the plan forward is that we really have to stop treating COVID like it is the only and most significant risk for our children. We know that other respiratory viruses can also cause severe outcomes in kids, and part of the shift that we are making is to support a sustainable transition that can help schools look at when they're having these surges in absenteeism, that there's a response that's appropriate to help not just with COVID but other respiratory viruses. And again, the required isolation that will be continued up till September 27th does not include required quarantine for whole classes. We recognize that intervention, which I believe was necessary last year prior to widespread vaccine availability, that is highly disruptive and causes significant harm. And so what we will be doing again is requiring isolation of those who have COVID core symptoms and those who have confirmed COVID, but we will not be requiring that classroom quarantine even prior to September 27th. And we'll be working with schools to shift towards, again, that symptom-based approach that can be effective and support schools and kids for not just COVID, but for other infectious illnesses as well.
Okay, thank you everyone. That's all we have time for. If you have any follow-ups, please reach out to myself or Dr. Hinshaw's team.